warm welcome to the news at 7. I am Comfort Amodu. Let's begin with the headlines. ECOWAS and German government donate consignment of medical equipment to federal government to strengthen fight against COVID-19. Experts give reasons on continuous increase of COVID-19 despite efforts to curb spread. Profile solution. Issues of health, rights of women and girls top agenda as World marks World Population Day. In 2020 Army Day celebration, Nigerian Army present compendium of achievements on fight against banditry. The presidency says the ongoing probe and investigation of the acting chairman of the Economic and Financial Crimes Commission, EFCC, is based on a series of documented allegations leveled against him. A statement by Garba Shehu, Senior Special Assistant to the President on Media and Publicity, says the suspension of Ibrahim Magu is to allow the institution to continue carrying out its mandate without hindrance due to the ongoing investigation. The presidency hinted that a proper procedure when allegations are made against the chief executive of an institution, and in this case, institution that ought to be seen as beyond reproach, the chief executive has to step down from his post and allow for a transparent and unhindered investigation. And now insisting that the EFCC does not revolve around the personality of an individual and as such cannot be seen through the prism of any individual. The statement emphasized that Magu is being availed the opportunity to defend himself and answer the allegations against him. The presidency therefore says the probe against Magu is an indication that the fight against corruption is real and are not scared cows. And for those who think they have a halo over their heads, their days are also numbered. No other administration in the history of Nigeria would have moved to bring into the light and public domain such an allegation, says the presidency. Now, the Nigerian government has received a large consignment of medical equipment donated by the German government and the Economic Community of West African States, ECOWAS, to strengthen Nigerians' fight against COVID-19 pandemic. Minister of Health, Dr. Osagi Ihenere, took delivery of the supplies in Abuja on behalf of the Presidential Task Force on COVID-19. Mitaire has more on this report.
So far, COVID-19 case standing in ECOWAS member states is more than 92,000 and more than 1,500 deaths recorded. Nigeria accounts for 1/3 of these confirmed cases in the sub-region and is a hub for ECOWAS COVID-19 response to member states.
President Muhammadu Buhari of the Federal Republic of Nigeria was appointed the champion, coordinating the regional response. And I wish to express our gratitude to him for providing facilities. These include a warehouse for storing all procured medical commodities and plane to distribute them to ECOWAS member states.
Nigeria's share of this consignment of medical equipment donated by the German government and WAHU, the sub-regional health institution, consists of ventilators, thousands of diagnostic test kits, medical gowns, locally produced hand sanitizers, and thousands of other personal protective equipment.
Our health workers are toiling assiduously in the fields and in the hospitals to handle COVID-19 patients, and I believe that the provision of these personal protective equipment and all others will generate even more peace of mind for them.
Coronavirus is going to be with us for some time. Therefore, it's really important that we get into the habit of modifying our behavior.
And we also commit to use everything presented to us judiciously in the response to this pandemic.
Apart from these equipment, ECOWAS is also pledging technical support in training for health workers and risk communication to strengthen Nigeria's fight against the COVID-19 pandemic. This medical warehouse in Jabi district of Abuja, donated by the Nigerian government to ECOWAS, will be a transit point for the storage and distribution of medical equipment to other ECOWAS countries to strengthen their response to the coronavirus pandemic. In Abuja, Mitaire Ikpen, NTA News.
President Hassan Rouhani of Iran calls for ban on ceremonies as the World Health Organization appeals for systematic research on airborne transmission of COVID-19. Let's now join Adebola Brooks Sunday for this and more on Global Update.
Iran's President Hassan Rouhani has called for a ban on big gatherings such as weddings to stem the rise of COVID-19 infections in the country until further notice, but says the country's economy has to remain open. The World Health Organization has called for more systemic research on airborne transmission of the novel coronavirus in closed settings.
There is the possibility that there could be aerosolized particles in specific settings like indoor settings where there are crowded conditions, where there's poor ventilation, and where people are spending prolonged periods of time. And so what we've seen is that there are some outbreaks that have been reported in these closed indoor settings with poor ventilation, which include the nightclubs, which have included choirs, fitness centers, where airborne transmission cannot be ruled out. In those outbreaks, there could also be the droplet transmission and fomite, the contaminated surface transmission.
At about 6:50 p.m. local time, the number of people infected with coronavirus globally now stands at 12,719,409. 564,623 deaths were recorded, while 7,415,851 persons have recovered from the virus, as reported by the COVID-19 Resource Center in Johns Hopkins University. From this figure, the African continent has 559,079 confirmed cases, 12,756 deaths, and 273,984 recoveries. The Nigeria Center for Disease Control also published 31,323 as the total number of positive cases of coronavirus in Nigeria. 12,795 people have recovered and 709 fatalities recorded. I am Adebola Brooks Sunday.
And joining me via Skype is Professor Oyewale Tomori, Chairman, Ministerial Advisory Committee on COVID-19, to speak further on the continuous increase of coronavirus in Nigeria. Thank you very much, sir, for joining us on the news.
It's my pleasure.
All right, we're witnessing a rise in cases of coronavirus, and it's mainly been attributed to community spread. What do you think is responsible for that?
I think from what we are seeing, many of our people are not abiding by the guidelines which is given.
Okay.
We are made to understand that wearing face masks, washing our hands, keeping safe distance are what we require. But I don't think we're abiding by that, and that's why we're having this great spread and upsurge in numbers of cases.
Okay, so how would you now assess COVID-19 response vis-a-vis other countries in West Africa in terms of challenges?
I think for us in Nigeria, you see, the issue is the people's attitude to it. And unless many of our people accept that we have a COVID problem, we're probably not going to see a drop in the number of cases. A lot of people in this country still believe that these numbers that NCDC is providing are not genuine. But I pray that they're not one of the numbers, because COVID-19 is genuine, is real, and is occurring. And people are dying from the figures we've seen. Only those who are affected will know what we're talking about. So my advice to our people is, please follow the guidelines that have been laid down by the government. Wear your face mask when you're out in the public. Ensure that you wash your hands and maintain the distance because of the nature of the disease. The WHO is coming up with new things about airborne transmission. And we're told to avoid closed areas. offices, air-conditioned things, a little space with many people. That's how you spread the disease.
Okay, tell us more on various committees' intervention on impacting the efforts of federal government, particularly in Ministry of Health.
Well, I think it was a great thing for the ministry to have set up this committee. Controls of diseases are driven by data. And if you don't have data, which is properly analyzed, then you run into a problem. Let me give you a good example. If you don't know the number of people that are sick, you don't know where they are, if you don't know those who have the diseases, you don't know what and things they do, then committee, which I think was set up about a month ago, have begun to look at the data as they come in. What is the situation? Where are the cases occurring? Who are the people being affected? And all this will be brought together. So we give real-time data and analysis to the government that will help it in controlling the disease. If you don't have your data, or if you come in too late, then of course you are behind the curve. And the disease will have spread to a place before you even know it's spreading there. And so this is the reason for all these committees that have been set up. And the committee includes things in the areas of laboratory, in issues of case management, in the issue of logistics, how do we send out things? PPE, how many do we have? Where are they located? The laboratories that are testing, where are they located? What's the access of the states to those laboratories? How soon do they get results back? These are the things that this committee is doing to assist the government, giving real-time information that will help it be proper control.
All right, thank you very much for your expertise there.
Thank you very much, madam.
All right, new HIV prevention, treatment and cure research has been unveiled at the ongoing 23rd International AIDS Conference, tagged AIDS 2020 Virtual, taking place in Oakland and San Francisco, United States. The new data provides insight into long-acting injectable HIV prevention drug with potential real-world implications for people living with HIV. Basi Ibrahim reports.
Since the inception of International AIDS Conference in 1985, it has helped in providing answers to most pressing research questions on HIV, and this year is no different. President of International AIDS Society and International Chair of AIDS 2020 Virtual said studies presented at the AIDS 2020 Virtual advanced world knowledge on multiple fronts show that long-acting injectable cabotegravir is more effective in preventing HIV than daily oral Truvada. The clinical trial is the first study to compare the efficacy of long-acting injectable with daily oral Truvada for pre-exposure prophylaxis (PrEP), and those will achieve long-term HIV remission without the need for a bone marrow transplant. Key players noted with concern that, despite great progress made since the early days of the epidemic, HIV response for children has fallen behind, as more children are dying needlessly from AIDS-related illnesses and deaths that could be prevented. The conference also agreed to a range of HIV prevention and treatment targets to reduce new child HIV infection to less than 40,000 within the year 2020 targets. Basi Taikpa, NTA News.
And with the validation of the RNA suit extraction kit for COVID-19 testing kit, an innovation with the capacity for testing of large number of people, the 5 million farmers and farm laborers will be tested. Justin Bemunyi reports that the RNA suit extraction kit for COVID-19 invented by the Nigerian scientists presents to Africa the uniqueness of commercial affordability and availability that has accurate and sensitive testing capacity.
A major challenge in the COVID-19 fight, particularly for developing countries, is how to increase the low level of testing capacity amid global scarcity and high cost of standard RNA extraction kits. A concern for both the urban and rural areas of the country where farmers reside. However, there are fears that the food security chain may be compromised by COVID-19 if measures are not put in place to stem community spread. The Federal Ministry of Agriculture and Rural Development had requested the testing of millions of farmers as a way of curbing the pandemic, especially now that community transmission is on the increase. Therefore, the innovation by a Nigerian scientist at the University of Sheffield comes as the most sought-after relief, with the validation by NCDC under the most stringent protocols with the National Biotechnology Development Agency, the Nigerian Institute for Medical Research, and Open Forum on Agricultural Biotechnology.
The kit is quite cheap. It is about 500% cheaper than what we have at the present.
Justin Bemunyi, NTA News.
Right now, Dr. Rose Maxwell Gidado, Country Coordinator, Open Forum on Agriculture Biotechnology, is in the studio to throw more light on the groundbreaking innovation of RNA sweep diagnostic kit for COVID-19 testing. You're welcome to the studio.
Thank you.
All right, the challenge of a test is now mitigated with RNA sweep COVID-19 test kit intervention. So relatively, how cheap and reliable is the kit?
Yeah, the kit is actually very reliable. It's cheaper than the commercial, the standard commercial test kits that are actually being used now by countries in the world. That's the Kiajin kit and then the Life River kits. And so it's 50 times, 50 times, cheaper, and then it's 500 times cheaper, and then it can actually increase testing capacity by at least 50 times. And then the cost is actually going to be in between $10 to $15, and that's, if you multiply it, $10 by $460, 460 naira per dollar. Of course, it gives you 4,600 per test, while the standard commercial kit takes 20,000 per test, and so it's as cheap as that. And then it is also versatile. It covers a broad spectrum, of many viral infections. It covers other disease outbreaks, not just the COVID-19. So you see, it's used not just for COVID-19, it's also used broadly. So it's an innovation, that was brought about, invented by a Nigerian
So tell us,
scientist.
how soon do we commence the use of the kit?
Where we are now, with the successful validation carried out by NCDC and the National Biotech Development Agency, where we are now, of course, we are just at the time of placing order, getting the state government, individuals, private sectors, to come in and place order. We're ready to start, the manufacture, and then the funding, of course, is being supported by the African Development Bank. The president of the African Development Bank is very passionate about this project, and I think all preparations are in top gear, for the manufacture of the first 10 million kits. It's going to be first 10 million kits, of course, to cover a very large, population in Nigeria. And Nigeria is actually going to be used as a hub, for other African countries, as a model for other African countries. And
all right, so we understand that Africa Development Bank plans to massively deploy the kits for testing across Africa. How would this be done, and what does Nigeria stand to benefit from the intervention?
Okay, Nigeria is going to be the hub, just like I said. Nigeria is going to be the hub. Nigeria is going to be the model for this, because we are starting here in Nigeria. And so for the other African countries, the African Development Bank is going to leverage on the capacities of the Center for Disease Control offices in other African countries. That is the in-country Center for Disease Control offices over there. They will leverage on their capacity to ensure expansive, elaborate testing. It's actually done. And so that's how it's going to be. And then they will start, they're also involving the Africa Center for Disease Control in this. The Africa Center for Disease Control will actually carry out another validation over there, and the successful validation that will result from that, of course, the other African countries will cover all African countries, all other African countries. That may
thank
be
you very
no
much,
need
Dr. Rose Maxwell, for the insight there. We do appreciate you coming to the studio always. This is the news on NTA International. We take a short break now. The news continues in a moment. Welcome back. And now, safeguarding the health and rights of women and girls around the world, especially during COVID-19 pandemic, is a central message as the world marks 2020 Population Day. Hamman Jabani reports that the concern is that with the ongoing COVID-19 pandemic, the estimated 7.8 billion world population is expected to rise due to unplanned pregnancies.
Well, when I saw my baby, I'm very happy, and I thank God for seeing my baby.
The arrival of a baby to the Jumo family and many other families on this World Population Day is a great joy to the families, but for the UNFPA and National Population Commission is something to worry about due to the increasing population. A recent UNFPA research revealed that if the lockdown continues for 6 months with a major disruption in health services, 47 million women in low and middle income countries might not have access to modern contraceptive. This will in turn lead to 7 million unintended pregnancies, with an intending rise in gender-based violence, female genital mutilation and child marriages.
We shall continue to pursue our mandate of generating demographic, health and social economic data for championing the cause of all, especially the cause of women and girls.
UNFPA is working to ensure that the supply of modern contraceptive and reproductive health commodities is maintained, and that midwives and other health personnel have the personal protective equipment they need to stay safe when they render services.
For the National Population Commission and its development partners, the COVID-19 crisis has taken a staggering toll on people, communities and economies everywhere, but not everyone is affected equally. Women, who account for a larger share of the frontline health workers, are disproportionately exposed to the coronavirus. For the likes of Jumo families, having more children is determined by God and will do the needful towards their well-being. Hamad Jabani, NTA News.
And the Chief of Army Staff, Lieutenant General Tukur Buratai, says the Nigerian Army is leaving no stone unturned in combating banditry and other criminal activities in various parts of the country, especially the Northeast. The Chief of the Army Staff said this at the 2020 Army Day celebration in Katsina. The ceremony, which was relocated to Katsina this year, kickstarts a major exercise tagged Ex-Sahel Sanity with a view to check banditry in the Northwest. He commended officers and soldiers for their efforts at fighting against the insurgency, stressing that the Nigerian Army is indebted of protecting the nation. The Chief of Army Staff attributed the various successes of the Nigerian Army within the past 5 years to the support by President Buhari. Now, officers and soldiers who distinguished themselves were honored with awards as well. Now, National Agency for the Prohibition of Trafficking in Persons, NAPTIP, will trace and track any trafficker of Nigerians to any part of the world. Director General of the agency, Julie Okadonli, said this when she received Temitope Olamide at the Nnamdi Azikiwe International Airport, Abuja, a Nigerian lady who was falsely charged for murder in Lebanon. Adebola Brooksney Sunday has the rest of the report.
31-year-old Temitope Olamide Arowolo finds her way to Lebanon in search of a greener pasture. Her story changed when she became a domestic worker, and her employer several times attempted to rape her. In self-defense, the employer sustained injuries and she was charged to court. Investigation reveals that Temitope Olamide Arowolo was sold into slavery in Lebanon. She spent over a year in prison on charges of attempted murder. It took the intervention of the National Assembly, NAPTIP, and the International Organization for Migration to make her repatriation possible.
We're happy to be back home. The whole issue hasn't come to an end because we really want to understand what happened in court back there in Lebanon.
She has to be quarantined for 2 weeks. We will now take her to the shelter, give her some psychosocial support because she's traumatized. So we have to counsel her and then rehabilitate her, empower her.
You're allowed to travel abroad if you want to work. However, we will not tolerate traffickers taking any of our citizens abroad to suffer them.
Temitope's experience, she said, is what she never wished for her enemy.
I advise the other girls to stay here in Nigeria and try to make it the way the Lord can put them through, because going outside there was like a hell. What I experienced in Lebanon, I pray even not for my Satan to experience it.
Temitope now wants the Lebanese government to be held responsible for the violation of her rights. Adebola, Brooklyn Sunday, NTA News.
And in Lagos, owner and tenants of a 3-story building at Fremont Street in Lagos Island are still in shock and mourning over the death of 2 persons, including a baby boy that died this Saturday morning when they collapsed on them while asleep. 8 of the occupants were rescued from the rubbles. Abolore Ogbara reports that the State Building Control Agency has attributed the unfortunate incident to the refusal of the occupants to relocate after the building's failed integrity test. And that concludes the news. Many thanks for watching. I'm Comfort Amodu.